Hey there, studying for the psychiatric nurse practitioner? Today, it's your lucky day. My name is Dr. Lopez. I am going to cover the most important topics you need to know to pass the psychiatric nurse practitioner board exam. I'll show you how. This is a little piece of our crash course review. You will not regret it. Most likely, you will see content that is very similar to what you will see on your board day. Make sure you write it down, subscribe to our channel, be in the know. Let's do this together right now. A coat. You have to think about two things, liver and pancreas. Depakote, two things, liver and pancreas, right? Because these are FDA warnings. Pancreatitis. When you have liver toxicity, you look at your AST, ALT. AST, 5 to 40, you take 5 away, you got ALT, 5 to 35. You want your Depakote level between 50 and 125. When you start to get about 150, it becomes toxicity level. And there you see lethargic, disorientation, decreased respiration, right? Nausea, vomiting. Moving on, Kava. Who do you give it to? Stress, anxious, and insomnia patients. What else do you what else do you what else are you concerned with Kava? Again, you're concerned with the liver. Never, never, never give Kava with benzodiazepine. I wouldn't say never. For the test, don't give Kava with benzodiazepine. Think about it. If you're giving for insomnia patient, it already puts the patient to sleep. You don't want to add anything that's going to potentiate that. So you definitely want to stop Kava before your surgery. Lamictal, Stevens-Johnson syndrome. Lamictal, Stevens-Johnson syndrome. Body aches, peeling skin, facial tongue swelling. If you have a patient that has lesions, skin rashes that goes away, continue Lamictal, because Stevens-Johnson syndrome does not stop without treatment. Okay? The question asks, the least likely weight gain, mood stabilizer, Lamictal. Take a medication when the patient is at risk for metabolic syndrome, Lamictal, as the mood stabilizer of choice. Antipsychotics, 3 are the least likely to cause weight gain. Zals, the ziprizodone, aripiprazole, lurazodone. Why? Because antipsychotics, especially or most likely atypical second generation, it trades off of less dopamine blockade, less EPS, but it gives you more weight gain. What makes it an antipsychotic atypical? The 5-HT2A. The 5-HT2As that's added to the antipsychotics atypical, the trade-off is less D2 blockade, but more weight gain. So you are concerned about the metabolic syndrome. The first sign of metabolic syndrome is hip to waist circumference increase, or waist circumference is increased. What are the metabolic syndromes? BMI, waist increase, glucose, lipid panel. 2 of them consider metabolic syndrome. Carbamazepine, Depakote, two things to remember, liver and pancreas. Pancreatitis, liver toxicity. Carbamazepine, two things to remember, agranulocytosis and aplastic anemia. You need to know what those things are. Aplastic anemia, bleeding gums, bleeding, rashes, shortness of breath, fatigue, especially nosebleed, bleeding gums. When it comes to carbamazepine, you're concerned about Asian population. And you have to test for the HLA-B 1502. But there is something about carbamazepine. It could also cause Stevens-Johnson syndrome. Then you have to ask yourself, what if you have a question in which carbamazepine and Lamictal is there? Which one should you pick? It depends. Does the question says Asian population? Yes, carbamazepine. No, Lamictal. What else are you concerned about carbamazepine? Agranulocytosis. Oh, gee. So there are other medications that could cause agranulocytosis, right? What are they? Clozaril. So you need to know when to stop Clozaril and carbamazepine. If you have any signs of infection, you stop it. So what are these? Fever, sore throat, weakness. You stop the medication despite of the A and C, regardless. Okay. Now, if the A and C is less than 1,000, you stop it as well. Okay. So when you look at carbamazepine, look at the 3 A's: agranulocytosis, aplastic anemia, and the last A for Asian population. Hey guys, so hopefully you enjoyed this content today. We went over some high-yield content, stuff that it is super important that we know that will be on your board certification. You may ask, how do we know? Well, we look at the blueprint. Plus, we have a proof of concept. Over 1,000 students have studied with us and done super well. Stop wasting time. Sign up at www.npexamcoach.com. My name is Dr. Lopez, and I'll teach you how to pass the psychiatric nurse practitioner board examination. See you soon.